Hello, my name is Chelsea Lively and I'm a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a SCAT5 concussion assessment. So first thing that you're going to do is you want to recognize and remove your athlete if you think that they have a concussion. And my athlete obviously came off the field and talked to me in this scenario. So for the immediate or on the field assessment, they're not on the field anymore, so they're off to the side. But if they were on the field, there's red flag. You want to look for the red flags. The red flags are neck pain or tenderness, double vision, weakness or tingling, burning in the arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, increasingly restless, agitated, or combative. After you look for the red flags, if there aren't any, you want to look for observable signs. Those are lying motionless on the playing field, balance, gait difficulties, motor incoordination, or like stumbling, slow, labored movements, disorientation or confusion, or an inability to respond appropriately to questions, blank or vacant look, or a facial injury after head trauma. So obviously, he's here and he doesn't have any of these symptoms, so I would put no for all of these. Next, when we're on the field assessment, I would do Maddox questions. So I'm going to ask you a few questions. Please listen carefully and give your best effort. First, tell me what happened.
So I was playing soccer and then I went up for a header and then I hit my head against another player.
Okay. Do you know where we're at today?
Yeah, we're at the FGC soccer complex.
Okay, which half is it now?
I believe it's the second half.
Okay, who scored last in this match?
FGCU scored last.
Okay, what team did you play last week?
We played FAU last week.
Okay, and did your team win the last game?
Yes.
Okay, good. So he answered all these questions appropriately, so he would get yeses for all of these. Next would be the Glasgow Coma Scale. So you would write down the time of the assessment, the date of the assessment, and the first thing you're going to look for is the best eye response. A 1 is meaning that there's no eye opening. A 2 is there's eye opening in response to pain. 3 is eye opening to speech, and 4 is eyes opening spontaneously. He's sitting here with his eyes open. He gets a 4. Best verbal response, no verbal response is a 1. Incomprehensible sounds is a 2, inappropriate words is a 3, confused is a 4, and oriented is a 5. We just went through Maddox questions and he seems pretty oriented, so he gets a 5. And then lastly on the Glasgow Coma Scale is best motor response. 1 is no motor response, 2 is extension to pain, 3 is abnormal flexion to pain, 4 is flexion or withdrawal to pain, 5 localizes to pain, and 6 is obeys commands. He's obviously available to obey commands, so he gets a 6. So you add these all up and it's a score out of 15, and the higher the score, the less likely they are to have a concussion. So the lower the score is, the more likely they are to have a concussion or a serious head injury. The next step in the examination is a cervical spine assessment. So does the athlete report that their neck is pain-free at rest? So when you're just sitting here, does your neck hurt?
No, not at all.
No? Okay, so if there's no neck pain at rest, does the athlete have a full range of active pain-free motion? So can you just move your neck around for me? All the way back, forward. Any of that hurt?
No.
No? Okay. And is the limb strength and sensation normal? So if I touch your arm down here, is there anything that feels different on this side?
No.
Now, do you feel like you're weak at all?
No.
No? Okay. So then that's the end of the cervical assessment. You could do an upper motor screen to make sure that his myotomes are good and his dermatomes are good. But for the sake of this, he didn't have he wasn't on the field when I found him, so we're not going to go into that. But in a situation where a patient is not lucid or fully conscious, it's always, you have to assume that there's a cervical spine injury. So next we're going to go into the office or off the field assessment. So This is where we're gonna go in a distraction-free zone, so like the athletic training room. And the athlete's gonna be at more of a rested state instead of adrenaline pumping. First, we're gonna find athlete background, so the team, the sport that they play on, their name, their gender, dominant hand, how many concussions they've been diagnosed with in the past, when their most recent concussion is, how long the recovery time was from the most recent concussion. So have you ever had a concussion in the past?
Only once before.
Okay, when was that?
About 2 years ago.
Okay, and how long did it take you to recover from it? Do you remember?
About 2 weeks.
Okay. And have you ever been hospitalized from a head injury?
No.
No. Have you ever been diagnosed or treated for a headache disorder or migraines?
No.
Diagnosed with a learning disability or dyslexia?
No.
Diagnosed with ADD or ADHD?
No.
Diagnosed with depression, anxiety, or other psychiatric disorder?
No.
Do you have any current medications? Okay. So now we're going to jump into the next step, which is a symptom evaluation. So this involves the athlete reading out the paragraph, the instructions, and then answering the questions of their symptoms. So if they have a headache on a scale of 0 being none, 6 being severe, there's pressure in the head, neck pain, again, all on a scale of 0 to 6. So they would go through and answer all of these themselves. So go ahead and read the instructions out for me.
This right here.
Yeah.
The athlete should be given a symptom form and asked to read the instructions. For the baseline assessment, the athlete should rate his or her own symptoms based off of how he or she feels. For the post-injury assessment, the athlete should rate their own symptoms at this point in time.
Good. So then they would go through and circle all the numbers. At the end, you would tally, or you would count up the number of symptoms that they have based on the numbers that they answered. If trouble falling asleep isn't applicable, then it's out of 21, but if that is applicable, then it's out of 22. The higher the number, the more likely they are to have a concussion. The lower the number, the less likely they are to have a concussion. And do your symptoms get worse with physical activity?
No.
Do your symptoms get worse with mental activity?
No.
Okay. And then we would ask them if the athlete is feeling, if 100% is feeling perfectly normal, what percent of normal do you feel? If not 100%, and why? So they would go ahead and write down their answer for that. So the next step is step 3. It's cognitive screening. So we're going to test the orientation first. So what month is it?
It is May.
Okay, what's the date today?
I believe it's the 29th.
Okay, and what is the day of the week?
Thursday.
What year is it?
2019.
And what time about is it right now?
About 11 p.m.
Good. So the orientation score is out of 5. For each question, he gets 1 point. He missed 1, which is what the date is today. Today's the 30th, so you get 4 out of 5, which is still good. The next step in cognitive screening is the immediate memory. The immediate memory component can be completed using the traditional 5 words or using the 10 word per trial. So now I'm going to test your memory. I will read you a list of words, and when I'm done, repeat back as many words as you can remember in any order. For trials 2 and 3, I'm going to repeat the same list again. Repeat back as many words as you can remember in any order, even if you said the word before, okay?
Okay.
So finger, penny, blanket, lemon, insect.
Finger, blanket, penny, lemon, insect.
Okay, again. Finger, penny, blanket, lemon, insect.
Finger, penny, lemon, insect, blanket.
Good. Last time. Finger, penny, blanket, lemon, insect.
Finger, penny, lemon, blanket, insect.
Good. So he got a score of 15 out of 15 because each trial is worth 5 points. So for this immediate memory, the lower the score, the more likely they are to have a concussion. The higher the score, the less likely they are to have a concussion. concussion. So since he got 15 out of 15, he did really good. Next is concentration, which is digits backwards. So I'm going to read you a string of numbers, and when I'm done, you repeat them back to me in reverse order of how I read them to you. For example, if I say 719, you would say 917.
Okay.
Okay? 493.
3, 4, 9.
Okay, so with this one, it gets a little tricky because each list, it has a series of 3 numbers, and if they get on their first attempt, if they get it right, then you move down to the string of 4 numbers. But since he got it wrong, there's an additional set of 3 numbers that he gets another shot at. So it's going to be, ready? 6, 2, 9.
926.
Good. So now after that, we're going to move down to the string of 4 numbers. I'll repeat that again. And each one of these you get 1 point for. So since he missed the first one but got the second one, he still gets full credit, so he gets a full point. So the next one is 3, 8, 1, 4.
4183.
Okay, so he gets a point for that one. 6, 2, 9, 7, 1.
17629.
Okay. 1, 5, 2, 8, 6.
68516.
Okay. 7, 1, 8, 4, 6, 2.
24786.
Last one. 5, 3, 9, 1, 4, 8.
How many numbers was that?
Okay, so he got a score of 2 out of 4 because the last 2 sets he didn't get them right. But moving on is going to be the months in reverse order. So now tell me the months of the year in reverse order. Start with the last month and go backward. So you'll say December, November. Go ahead.
December, November, October, September, August, July, June, May, April, March, February, January.
Good, so he gets a point for that one. So for the concentration section with the digits backward and the months in reverse order, he gets a total of 3 out of 5, which again, the higher the score, the less likely they have a concussion. The lower the score, the more likely they are to have a concussion. Step 4 for the SCAT5 is neurological screening. So for the first step, it's can the patient read out loud and follow instructions without difficulty. So we addressed this earlier when he read out loud the symptoms checklist, and he did a really good job, so he gets a yes for that one. Does the patient have a full range of passive or pain-free passive cervical spine movement? So we did active, but now we're going to do passive. Alright, did any of that hurt?
No.
No? Okay. So he gets a yes for that one. And without moving your head or neck, can the patient look side to side and up and down without double vision? So I'm going to have you follow my finger. Did you have any double vision with that at all?
No.
No? Okay, good. Can the patient perform the finger-nose coordination test normally? Okay, so now I'm going to have you stand up. Okay, so what you're going to do is you're going to have your arms out to the side and then touch with each hand with your finger. So go ahead and go. Good. And stay standing for me. Can the patient perform the tandem gait normally? So now what you're gonna do is put your feet like this and then walk forward. So usually for the tandem gait, you would want to do that for 3-meter line, and then they would turn 180 and walk back, but I don't have the space in here to do that. So he just did it for a couple steps, but that's what you would normally do. Next is a balance examination. So we'll jump into which foot would you kick with in kickball?
My right foot.
Your right foot. So we're going to be testing his left foot since he's right foot dominant. And then we're going to record the testing surface, which is a hardwood floor, and then his footwear, which he's barefoot right now. So the first one is going to be the double leg stance. So have you stand up for me. And all you're going to do is stand with your feet shoulder width apart, hands on your hips, and then close your eyes. So during this, we're going to be looking for any errors, such as hands lifted off the iliac crest, the eyes opening, they step, stumble, or fall, moving the hip into greater than 30 degrees of abduction, lifting the forefoot or the heel, and remaining out of test position for greater than 5 seconds. You can go ahead and stop. So with this, they're going to stand in that position for 20 seconds. The next one is the single leg stance test. So since you're right foot dominant, I'm going to have you stand on your left foot. Go ahead and put your hands on your hips and close your eyes. Good, go down. Okay, so for him, he put his toe down once, so that means he would have one error. And as long as they don't have a high number of errors, then he's considered good. So he only had one error, which is considered low. He didn't have any errors for the first test. So the lower amount of errors, the less likely they are to have a concussion. The last one is a tandem stance. So I'm going to have you put your right foot in front of your left foot. And your toes touching. Good. Put your hands on your hips and close your eyes. Okay, good. And again, you would have them hold this for 20 seconds and count how many errors that they would do. The last step, or step 5, is the delayed recall. So it should be done 5 minutes after the first time I said the words. So do you remember the list of words I read a few times earlier? Tell me as many words as from the list as you can remember in any order.
Lemon, penny, insects, blanket. That's all I remember.
Okay, so you got 4 out of the 5, which is really good. And the last step is the decision. So you calculate, or you put all your numbers in. So from the symptoms out of 22, orientation out of 5, immediate memory, concentration, neuro exam, balance, and delayed recall. As far as his numbers, I don't think he has a concussion because he didn't have enough symptoms, and he did really well in all of the testing. And if he were to have a concussion, then I would send him home with a list of instructions to his parents on what to look for, or like his roommates, I guess, on signs to look for in case like he needs to go to the ER, like a worsening headache, repeated vomiting, weakness or numbness in the legs and arms. And since he doesn't have a concussion, we don't have to worry about the graduated return to play. But yeah, that's a SCAT5.